Prevention is a big topic and in a bad state in our country. If you look at healthcare, the costs over a lifetime, over the population, dramatically increase over the last years of life, specifically over the last 2 years of life. And prevention obviously tries to get the foot in the door somewhat a little bit earlier. It's about between 1% and 3% of our health dollars are spent on prevention. Okay, 97 to 99% of our health dollars are spent on intervention and treatment of disease. So you see already on this number that actually our so-called health care or health system is not really a health system, is a disease management system. And for a variety of reasons, not the least economical, prevention obviously doesn't bring a lot of money. But now with the oncoming avalanche of childhood obesity, everybody's right now waking up. Because if that trend continues, it will ruin our healthcare system, not just to talk about the individual suffering and pain which diabetes and obesity and the complications of heart disease and stroke, early heart disease and early stroke, and kidney failure and what have you will bring. Okay, and shortening of life expectancy. So maybe now a new wave is coming, but this new wave might actually become not so much out of the doctor's office and offices, but more out of public programs, competitions between schools, so new and creative forms of engaging people outside of the doctor's office. So let's see where that goes. Now, if you think about prevention, and I'll have a preventative test in medicine, what does that mean normally? It means you get, if you're a woman, you get a mammogram and a pap smear, and if you're a guy, you get a prostate, rectal exam, and potentially a PSA test. Also, that's a little bit obsolete right now or discussed. Potentially colonoscopy when you're above 50 every 5 to 10 years. That's preventative medicine. Okay, and that's what normally we understand in Western medicine about prevention. But having said that, it's not really prevention, is it? It's early detection of disease. Okay, which obviously is better than late detection of disease. So to speak, it prevents something, but it's not what we actually think about the word prevention when we just think about it. Yeah, an ounce of prevention and then is much better than treating, you know, and you can treat much easier if you prevent a disease than treating the disease, even if you get them early and catch it early in life. So per definition now, that thing, real prevention, we call primary prevention. That means you actually prevent ever to get heart disease, you prevent ever to get cancer, you prevent ever to get Alzheimer's, diabetes, arthritis, and what have you. Yeah, and that is really interesting, especially for young people. Okay, so if you want to primarily prevent arthritis and degenerative joint diseases, which is the #1 cause of disability in this country, #1 cause of disability in this country, you will know that all this madness of extreme sports and repetitive sports and we allowing our youngsters to get hurt and injured over and over again and hold that for, you know, whatever it is, a good attitude will pay for it, and we know that. Yeah, there's no question about it. You start out that way, repetitive, extreme sports, you're going to have problems in your 40s, certainly in your 50s. Okay? And that's just the story. But we somewhat need to communicate these things. Primary prevention is preventing all these things. And obviously, it has its own challenges, not always so easy. We'll talk about that. Secondary prevention. Secondary prevention is early detection. Yeah? So what we call a preventative screen, early detecting all these preventative health measures, that's early detection of disease. Great, fantastic, nothing against it, just secondary prevention. Yeah? You already lost and missed the real good way of going about it. And I'm not saying everything can be prevented. Life is complex, okay? And we don't have all the answers. And we individuals, and there's a multitude of different varieties to life, endless varieties. And, you know, we only can hold to the truth we developed epidemiologically and statistically, okay? That certain behaviors will result in a higher chance of staying healthy. Now, individually, as you know, statistics say something about statistics, say nothing, zero about you. Yeah? If you have a 99% chance of getting heart disease due to high blood pressure, diabetes, high cholesterol, overweight, let's say, you can be individually perfectly fine and live to 100 with all these diseases and doesn't even touch you. Okay? I mean, that's often the example. The grandfather, you know, who smoked and did everything wrong, and here he lived into old age, and some health nut dies early, yeah, who tried to do everything right. It's humbling sometimes in medicine. There's individual, we do not have control, okay, despite our striving for perfection, some nations more than others. But we don't have total control of life. And life always has a bad prognosis, if you think about it. Yeah? We're all not probably going to make it. That's how it's set up. You know? So the whole story is not about denying death. The whole story is about living healthy and long and vital and happy and fulfilled, that at a certain point you can lay away the knife and the fork and say, thank you. Let's move on. Okay, in a good way. Secondary prevention, early detection. Tertiary prevention is when you already have a manifest disease. Let's say you have a heart attack or had a heart attack, and now you try to prevent that you have the second one. Okay? Or you try to prevent that you'll run around with constant chest pain and shortness of breath and constant symptoms, which totally ruins your life. And so on, yeah. So that's tertiary prevention, and that the same true with cancer. You had cancer, and then you do everything to make sure you do not have a recurrence. So all these things run under the expression prevention. Yeah, just you have to be clear what we're talking about. Yeah, and all this is valuable depending on where you stand in life, and on which stage you are in life. All three are valuable. Now there's a new form of prevention recently, which is the fourth form, quaternary form of prevention, which then actually says, basically, don't do stupid things. Okay? Out of the idea of trying to prevent something, don't do stupid things. You know, that's just basically the same like in medicine. Hippocratic oath, first do no harm. Profound wisdom. Every doctor will fail in that. That's given in the system, as we all fail in our lives. We cannot stay totally innocent. You know, it's a dangerous area. It's complex, but it's an ideal to strive for and to rethink that ever so often. First, do no harm. And quaternary prevention means, for example, if you think about youngsters and their upbringing and us trying to prevent them getting sick frequently, and then installing a health policy which with the Puritan background of America goes over very well, which means let's kill these bad bacteria as early. Let's bring up hygiene as much as we can. Let's live in a sterile environment, and let's not expose our kids to dirt. End result is it will backfire, and these kids will have more infections because this little dirt and so on, which they're exposed to, and they always were, back into history, trains the immune system. Okay? So if you're over-eager to try to prevent something, you have to be very careful, because to the back door, it just might come back to haunt you. Yeah? Quaternary dressing. Lately, the latest thing is the calcium thing. You know, it's preliminary still, but we're treating osteoporosis with high doses of calcium,